Democrat Abigail Spanberger is a former CIA officer challenging Congressman Dave Bratt in Virginia's 7th District. Democrat Gina Ortiz Jones is an Iraq War veteran challenging Congressman Will Hurd in Texas's 23rd District. And Democrat Lauren Underwood is a registered nurse and former senior advisor at the Department of Health and Human Services challenging Congressman Randy Holtgren in Illinois' 14th District. All of those incumbents are Republican men. So, ladies, thank you for joining us. Let's start with Abigail. What issue are you running on?
So I'm running on the issues that are most important to the people in my district. And when I've traversed our district from top to bottom, the #1 issue that people are talking about is really health care. And that's the priority issue that we're talking about along the campaign trail, in addition to jobs and education, issues of national security. But across the board, the thing that troubles our constituents most is really the future of our health care system.
And what do you want to see changed in Congress in regards to health care?
In regards to health care, I want people to have certainty, and constituents within our district want certainty around the costs of their health care premiums and their co-pays and what programs and insurance carriers they will be able to use into the future. But even more than that, what I want to see in Washington, what I'd like to bring to Washington is leadership that listens to the people in their districts and provides representation to the constituents back home. And so that's one of the reasons why I'm running, because I feel that our district needs better representation.
Gina, how about you?
I'm similarly running on health care. I mean, when I talk to people all across the district, whether in San Antonio, Del Rio, Socorro, it's not lost on folks that, this Republican voted for a tax plan that would cut Medicare by $25 billion, right? I mean, the fact that if you have a baby in Texas, you're 5 times more likely to die during that process as a woman than if you had that same kid in California. So, we're a state that is well-resourced. We'd be the 10th largest economy in the world if we were a country. And to have these healthcare statistics in our state is embarrassing. So I'm running on healthcare to ensure that everyone has access to quality, affordable healthcare.
Can you also commit, though, to working across the aisle and making it a bipartisan issue rather than one party votes for one piece of legislation, the other party votes for another, undoing it when they get back into office?
Oh, of course. I mean, I think healthcare should be a nonpartisan issue, right? Frankly, the only incentive when we talk about the health of our country should be our country's health. It should not be profit. The other, I think, frankly, the last segment also reminded all of us, though, of why we need representation in Congress. I mean, for you to lay out a number of facts on national security and for that representative to make this, comparison to men are from Mars and women are from Venus, that exactly shows how the conversation is distorted and frankly, deficient in understanding the real issues and how they consider the perspectives of women on these.
Lauren, how about you? What are you running on?
So healthcare has been a major issue on our campaign. I'm a registered nurse, and I've spent my career working to provide healthcare coverage for populations around our country. And so voters come to me and they say, what can we do to make healthcare more affordable? How can we ensure that we have a range of mental health care coverage to combat our opioid crisis? And how can we really stabilize the marketplace? In our district, we have 37,000 people who currently are insured through the Obamacare marketplaces. And so they're looking for some stability, like Abigail mentioned, but also to make sure that it's affordable for middle-class families.
Any legislation that's already been proposed that you would consider signing on to if you were elected?
Oh, certainly. I believe that we have had a variety of very focused, targeted legislation that's looking at making sure that Americans have a better deal and making sure that health coverage in particular is affordable for years to come.
Ladies, thank you very much for joining us. Again, it is all about the issues, not necessarily about who has what. We appreciate your time. Good luck out there. Abigail Spanberger, Gina Ortiz Jones.